You might know Bryan Johnson as the crazy reverse aging guy. He's made this video on how he fixed his terrible oral hygiene. Today we're going to react to that video, and I thought this was a really great video to react to because this week is actually Australian Dental Health Week. The theme for the week is gum health. So let's have a look at this video and see what Bryan Johnson has to say about how to look after your gums.
It's possible I have the most extensive oral care of anyone on planet Earth. Today I'm going to share what I do and what you can do at home to get your oral health in tip-top shape.
So he's got a water pick there in that screen before, and now we've seen a Sensodyne toothpaste, Biomin Restore, and in the lower screen there we've got some mouthwash, and that's by the same company as Waterpik. That specific mouthwash has been doing the rounds on social media recently, and they've been sponsoring influencers to market the product.
Now, as with all things Blueprint, you want to take baseline measurements. I know when I've gone into the dentist previously, you go there, they do a cleaning, the dentist will come in, they'll give you a look over and say, no cavities, great, you're good to go. But oftentimes that...
When we do a examination, it's actually called a comprehensive examination. Every regular checkup, we always check the muscles around the jaw, check if there's any issues with jaw movement. Then we have a look at the cheeks inside the mouth, around the gums, and the back of the mouth as well as the tongue. And then after that, measure around the gums, check for any signs of gum disease, see how the oral hygiene's looking. And finally, the very last thing we do is actually look at the teeth.
We said we want to look at pocket depth, which is you take from the top of the gum to the bottom of the pocket, and you want to see how deep that is. If it's 1 to 3 millimeters, you're in good shape. If it's 4 or 5,
and if it's more than 5 millimeters, then we'll have to refer you to the gum specialist for some deep
second
cleaning.
Is attachment, where you want to see the firmness around the tooth. Third is you want to see plaque index, and then you also want to measure how easy or hard it is for your gums to bleed.
The bleeding is a sign of gum inflammation, so that goes along with bacteria building up around the gums and inside the gums, which can irritate the gums and make them swell up more with blood. Just like if you had a rash on your arm, the rash looks more red because the blood is flowing to that area.
The first thing I do in my protocol is I use a water pick.
I agree that the water pick is an amazing addition to your oral hygiene routine. So the order that I would do it is using the floss first. So the reason for that is you're cleaning out in between the teeth with the floss and also loosening everything up that isn't coming out. And then when you use the water flosser afterwards and flush out in between those teeth, then you'll really clean that area really well. And you do that before you brush your teeth so that when you brush, those surfaces in between your teeth are already really clean, so the toothpaste can flow onto there and have direct contact to the tooth.
And so it really is effective in getting your mouth really clean. I do this for the first step. Now after water picking, flossing is number 2. I use this Dr. Tongues. It has a more thicker...
Honestly, any kind of floss is good. Just find what works for you. So something that doesn't really tear and you can get it in between your teeth nicely, that's the one to use.
Third step is I use...
Wait a second. Mine's a bit beat up, don't judge. I need to replace the head on it, it's a bit gross, but wow, we have the same toothbrush. This one's really good because it's got a pressure sensor, the Oral-B toothbrush. Comment below if you want me to take apart this toothbrush and see what it looks like on the inside, because I have a feeling that this might be disgusting on the inside. I've had it for, I'd say, more than 5 years, and yeah, I think it might be time for me to get a new toothbrush.
An electric toothbrush. Now I prefer the electric because I find it cleans my teeth better, but you may prefer a manual and that's just fine. Find the one that's right for you. Now with my electric toothbrush, I prefer soft bristles versus hard because I find that it doesn't look like
Bryan's using the softest head. He's using just, it looks like he's got the cross action head. There is one that's like a plain blue color, which is made for sensitive gums.
As for my toothpaste, I currently am using 2. I use 1 in the morning, 1 at night. These pass because they don't have fluoride, they help whiten.
Okay, so that's interesting to know that he doesn't like fluoride toothpastes. As a dentist, we do recommend fluoride because the fluoride does a great job in slowing down the metabolism of the bad bacteria in your mouth, and also the fluoride will reinforce the teeth and make them less prone to cavities. But in saying that, there are a lot of new toothpastes that are coming out which don't have fluoride in them, which have other means of action which actually are quite good. There's a growing trend of toothpaste having xylitol in them.
Step number 4 is a tongue scraper. Why didn't anybody tell me about this? These are really important. So the tongue gets kind of dirty, just like the teeth do, and it needs a cleaning just like the teeth do.
So there's no science on whether the tongue scraper actually decreases the risk of cavities. The bacteria that is most responsible for causing cavities actually doesn't really grow on the tongue much. But in saying that, keeping the tongue clean will reduce the overall bacterial load in your mouth, which will help slow down the rate that bacteria will grow on your teeth in general, which will, I guess, indirectly reduce your risk of cavities. But there's no proven science yet.
Now for mouthwash, I've used this guy. It has xylitol, and I only use it in 2 circumstances. One is when I'm about to be in close contact with others to avoid having bad breath. We all know what it's like to talk to somebody with bad breath. And then secondarily is if you're about to smooch and you want to be freshened up.
If you do really want to use mouthwash, do it before any of the other steps in your oral hygiene routine. You can do it just as a mouth rinse, or you can even pour it into your water pick and use it that way to flush out around the teeth a little bit better. The reason why that we don't do it after we brush our teeth is that if you rinse your mouth after you brush, you're flushing out all the calcium or fluoride that's been put in your mouth from the toothpaste.
Next is bruxism. This one's near and dear to my heart. For 20 years, I was grinding my teeth at night. Now, if you have bruxism or you think you may have bruxism, I'm going to strongly encourage you to try to address it. The dentist I spoke with would recommend a mouth guard of some variety. Sometimes it was hard, sometimes it was soft. I would grind my way through those. It didn't stop my grinding, it just created a cushion for my teeth, but it still created the wear and tear. When you're grinding, it not only just creates wear and tear on the teeth, but also increases pocket depth, it increases attachment loss, it just ages your entire mouth.
That's not exactly true. Grinding definitely wears down your teeth, which will age your teeth. Putting more stress on the teeth will strain some of the ligaments around the teeth temporarily, but there's no science that's confirmed that that's actually increasing your risk of gum disease.
And so I didn't fix it until a dentist recently on Blueprint recommended this one, which is Somno Dent Device. And what it does, it's a top and a bottom layer, and it arrests your mouth.
There may be indirect factors. A lot of the time with grinding teeth, it can be related to sleep apnea. So if you have sleep apnea, then indirectly your mouth will be a lot more dry because you may be snoring and breathing through your mouth more, and having a dry mouth will change the type of bacteria and in the mouth, which can increase the risk of cavities and also increase the risk of gum disease.
It's been able to arrest my bruxism, and it has stopped the decay of my teeth quality. And then of course, we all know this, it's wise to visit the dentist every 6 months or so to get a teeth cleaning, remove the stains, and get an assessment on how we're doing with our oral health. You may guess I have done some out of the normal things for my oral health. If you're interested in these more advanced therapies to try and correct challenges you have, they are on my website, protocol.bryanjohnson.com.
Okay, like and subscribe if you want me to have a look at those more interesting protocols, and we'll make a follow-up video and let's see what we think about those recommendations.